My child has started stuttering is a phrase that causes anxiety in the parents of the child and also that treating general practitioner who has limited teaching regarding stuttering. Stuttering, also known as stammering, is a speech disorder in which the flow of speech is disrupted by involuntary repetitions and prolongations of sounds, syllables, words or phrases, and involuntary silent pauses or blocks in which the stutterer is unable to produce sounds. Normal speech relies on the following: 1. Muscles of breathing. 2. Muscles of phonation or voice production near the vocal cords. 3. Muscles of articulation, throat, palate, lips and tongue. 4. Hearing. And 5. The brain, which coordinates the 20% of normal children stutter which lasts longer than 6 months in 5% of children. The child is usually 2 to 6 years old with more boys than girls being affected. The Stuttering Foundation described genetic studies in 70 families who had more than one family member affected by stuttering or family clusters. There appeared to be a group of markers on chromosome 18 which are being further investigated. 60% of stutterers have a family member who stutters. Gray matter volume was reduced in parts of the frontal and temporal lobes of the brain in a study of stuttering speakers versus non-stuttering speakers. Gray matter volume is related to dendritic spine density in these areas. Although there are no studies, there are likely to be associated immune abnormalities within the brain as with most other conditions affecting the brain. Stuttering can be regarded as a normal part of speech development. These are called disfluencies. Examples include the following. 1. Occasionally repeating syllables or words once or twice, like this. 2. Hesitances in the use of fillers such as hum. Disfluencies may last weeks and then disappear as quickly as they started. Disfluencies may be the result of an increasing vocabulary resulting in a mismatch with the ability of the physical production of speech by all of the above muscle groups. Mild stuttering may result in the following: repeating sounds more than twice, like this. The pitch of the voice may rise with repetitions. Blocked speech, that is, no voice production. The episodes of stuttering last longer and the child's face may express fear during the episodes of stuttering. Severe stuttering results in more than 10% of speech being affected. The child uses different words and extra sounds to start speech. There are increased levels of fear or anxiety. The approach to mild stuttering is to talk slowly and clearly to the child, and this includes family members and nursery and school staff. Such an exercise could be performed at certain times of the day when the child will have your undivided attention. The child may tell you about his fears and anxieties. If you respond after a pause, then this may also reduce the child's anxiety and fear. When there is deterioration in the stuttering, this probably reflects an increase in the underlying fear and should be approached with increased patience and tolerance. Reassuring the child verbally it is okay and giving the child a cuddle is a great way to reduce the child's fear. Shouting and punishment will not make the nerve cells in their dendritic spines grow, and the increased stress will actually reduce nerve cell connections in dendritic spines. Severe stuttering usually requires referral to the speech and language specialist. Hearing impairment and other conditions will be excluded. Only 1% of adults stutter, and so the outlook is very good. Sometimes the outlook or prognosis is not so good if there are the following risk factors. 1. A family member who stuttered still stutters as an adult. 2. The stuttering has continued for over 1 year. 3. If the stuttering began over the age of 3 years old. 4. If the child is a boy. 5. If sounds are left out of words and there is difficulty in understanding. In summary, stuttering is part of normal speech development in 1-inch 5 children. Only 1-inch 100 adults stutter, and so the outlook or prognosis is very good. However, it is best to ask advice from the general practitioner if sounds are being repeated twice, there is repetition of words, the voice is becoming high-pitched with sometimes no voice at all, if the stuttering has lasted more than 6 months and the episodes are lasting longer, and if the child is appearing fearful or anxious when talking. Early intervention is highly recommended. The Stuttering Foundation and the British Stammering Association internet sites are recommended for further information on stuttering.